The worst things about having COVID is when I stay in the hospital, first day to fourth day, I got high fever. Day and night continue, 4 days. Total of 17 days period I stay in the hospital.
I think this is definitely, without doubt, the pandemic of our lifetime. We have had the SARS virus in 2013, the Middle East respiratory virus in 2012, and of course the pandemic H1N1 in 2009. And this one isn't exactly that. It is essentially like the Spanish flu, the pandemic 1918, reenacted in real time in our lives. Looking at the sort of, surge of over 1,000 cases a day, it will be not honest of me to say that everything was fine. But at the same time, I knew we would overcome this. I was impressed by the efforts that everyone put in. All stops were pulled, all hands on deck to try to contain this outbreak.
The transformation COVID-19 has had on our lives is immense. But how does the virus that started it all really work? COVID-19 spreads like the common flu, through droplets as we talk, sneeze, and cough. These droplets carry the virus into the soft tissues in the eyes, nose, and mouth. From there, it enters the bloodstream and attacks the respiratory system by entering and destroying cells. This process slowly destroys our breathing apparatus and weakens our bodies. To many, it might sound like the common flu.
This is definitely not the flu. There's a vaccine for flu, there's an effective antiviral treatment for flu, and so far we still don't have a vaccine for the coronavirus.
While many people globally have built up immunity to seasonal flu strains, COVID-19 is a new virus to which no one has immunity. And some will suffer severe symptoms because the virus is allowed to carry on multiplying, destroying cells unchecked by immune systems.
There's currently no effective treatment or prevention through a vaccine for SARS-CoV-2 that causes COVID-19. And a large proportion of the world is actually still vulnerable to the infection.
The vast majority of infections are in the United States, Brazil, India, and Russia. According to the World Health Organization, as of end November 2020, nearly 1.5 million people have died globally. That's about 3% of all reported COVID-19 cases. In Singapore, more than 58,000 have been tested positive, and the fatality rate stands at 0.05%.
Our fatality rate is actually very low, in contrast with many parts of the world. I think it boils down to several factors. Number one is we never allow our healthcare system to be overwhelmed by a surge of cases. Number two is that our healthcare workers are really very well protected. They have all the equipment they need to look after patients well without being infected. And number three is really we are able to detect a lot of patients early and give them the necessary treatment.
Many of those who make up the bulk of the infections are also from a very specific demographic.
The large numbers are contributed by the foreign workers, and these foreign workers are generally fit and are relatively young. So most of them are in fact either asymptomatic or had very mild infections.
The disease is especially devastating for those who are immunodeficient or have a compromised and weak immune system, like those who are over 65 years of age or have existing underlying medical conditions. We understand how dangerous COVID-19 is, but here's what makes it so elusive.
So asymptomatic carriers are essentially infected patients who do not show any symptoms. And we now know that it's about 30-40% of everyone that is exposed and infected with COVID-19 virus. So why is it dangerous? Because if you do not know you're infected, you will move around the community. Many people believe that they are fine, they don't have COVID-19, and they will spread it to a lot of people. Now, if you are young and healthy, you are probably going to be okay, but don't forget that your parents, your grandparents, your neighbors, and your friends may be in the older age group with medical problems, who, if they get infected with the virus, they can do very poorly.
I got already the COVID-19 positive. Then my mother, my wife, my daughters, they will cry. But I tell them, don't you worry, I can survive. I'm very worried also if I cannot recover, what happened to my family? My boss, my section manager, they told me and assured me, Armando, don't you worry, we are here to support you.
It might seem like we have the odds stacked against us, but there are currently still highly effective ways to stop this disease in its deadly tracks.
It boils down to a few simple measures that we need to embrace as part of our lives. Number one is to avoid crowded places. Because the virus has to spread between people, and if there's no one around you, you can't catch it.
Transmission of the virus was just 3% when individuals kept a distance of at least 1 meter from each other, while the rate of transmission was 13% when the distance was less than 1 meter.
And if you have to be in situations where there are a lot of people, then you should wear the mask. I think the mask is our best protection. I know it gets tiring. We weren't used to wearing a mask all the time, but the COVID-19 virus is not going to go away like SARS, so we'll have to make this our habit, like brushing your teeth.
Wearing masks had an even stronger effect on the spread. The rate of transmission plummeted from 17% when not wearing masks to just 3% when doing so.
I interrupt the people. I tell them, please, don't gathering for so many people. I will inform to them because I experienced already what I can get the virus. That's why I want to minimize the COVID-19 spread out.
Whether it is a drug or a vaccine would take on average about 15 to 20 years. So for this pandemic, what we are seeing is unprecedented ways of doing things to try to compress that timeline.